He was a morbidly obese surgeon destined for an operating table and an early death. Now he's a rebel MD who is fabulously fit and fighting to make America healthy again. This is Stay Off My Operating Table with Dr. Philip Ovadia.
Go. Welcome back, folks. It is Stay Off My Operating Table with Dr. Philip Ovadia, and we are doing something different today, really different. And when Phil suggested this to me, or when Brian suggested, I don't remember who suggested it, I said, oh man, that is a great idea. Our guest today is Brian Keith, the Chief Operating Officer of Ovadia Heart Health. And there's it probably doesn't really show up, but I'm drinking my coffee this morning out of my official Ovadia Heart Health coffee mug, and it does actually improve the flavor, I'm happy to report. Phil, I'd love to really just sit back and listen to you guys talk. It's difficult for me to set it up for our listeners other than to say,
I'll set it up.
what's happening? Okay,
I'll set it
Brian,
up.
set
Here's
it
the
up,
problem.
Gene.
The problem is incentives. That the doctors we remember from watching Little House on the Prairie were incentivized to heal you. And a lot of doctors now, that's not actually their incentive. They have some other incentive, but it's opaque to you, the consumer. And so the problem is, by the time you have a doctor who is incentivized to heal you, as in make you stop paying them, then they must already be independently wealthy, at which point they're no longer going to be a doctor, because why would they want that kind of stress? If you go to an insurance company, their goal is to get as much money out of you as possible while treating as little of your illnesses as possible. What is the other option? And that's the pickle that Dr. Ovadia saw himself in. And the answer to that was, why not keep on being a surgeon while also starting a heart health practice, so that you don't rely on the money from the heart health practice, so that you can be incentivized to heal instead of keep clients around. We want to keep them around in terms of living, not in terms of paying us. And that is something extraordinarily unusual, and involves basically Phil sleeping very little for the last 5 years, as far as I can tell. Is that about right?
Sleep is definitely the pillar of metabolic health that maybe I can have the most room for improvement on.
Yeah.
But yeah, we just thought, right, it's the beginning of the year. We're recording this on January 2nd, and that's oftentimes opportunity for both reflection and planning, looking forward. What is the next year going to look like? And we realized that we really haven't on this podcast spoken a lot about the medical practice that has been built. We actually had Brian on the podcast way long ago, but if you dig into our archives, it's one of our early episodes. And I think at that time we were really in the early stages. And it's now been 5.5 years since this practice has launched. And Brian has been an instrumental part of that. And we just thought it would be a good opportunity to talk about what is truly unique about the practice, what we're doing in this practice. And my hope in doing so, right, is not to really promote myself or us or this practice, right? I really hope to inspire other practitioners to do this. I don't want to be the only one out there kind of doing this type of thing. And that's something else that we are looking at as we think about our evolution in 2026. I guess I'd start by pointing out a few of the things that make this practice unique. And each of these things in and of itself is unique. And when you bring the 4 or 5 of them together, like I said, as far as I know, this is the only practice of its kind. We look at that the practice is telemedicine only. I don't have a physical office for this practice. We don't have someplace that patients need to come to see us. We see them wherever they are via telemedicine. And telemedicine has grown significantly. It's still nowhere near as utilized as I think it needs to be, but having a telemedicine only practice is very unique. Doing that as a full medical practice in all 50 states. I am now licensed in all 50 states plus Washington, D.C. Lisa, our nurse practitioner, is waiting for one last state to approve her application, and she'll be able to say the same. And again, That's something very different. You see a lot of practitioners out there that will do health advice or health coaching, but they won't actually deliver medical care nationwide. Our team-based approach, it's not just me, it's Lisa's our nurse practitioner. We have three amazing health coaches, Krishna, Chris, Jen, who are very integrated into the practice. Health coaching isn't an afterthought for us in this practice. It is an integral part of what we do. And then our focus on metabolic health first and foremost, right? It's not about pharmaceuticals. It's not about managing disease, like Brian was saying. It's about reversing disease, curing disease, so people aren't reliant on us. We want people to not need us. And of course, that gives Brian some headaches as the business person behind this. And maybe Jack, as a marketer, would say that's kind of crazy to be telling people, we don't want you to need us, but that's exactly what we do. And you bring those four together, and I think it really has combined to a very unique thing that we've been building here.
Let me add on to that. Another thing that is unique is the doctor-led, that many organizations like this are owned by private equity, or they're owned by an insurance company, or they're owned by a hospital or something else. The doctor mindset, as many headaches as it creates from the business side of things, because Dr. Ovadia is first and foremost a doctor, not an entrepreneur, that it creates a different vibe. It's a vibe for the patients. It's a vibe for our plans for how to help people get healthy or reverse disease or get off drugs. It's a vibe for our team members. Most medical practices that might look on the outside like us are actually owned by someone else. And it might not be obvious to you, the consumer. And when, for the doctors listening who are thinking about exiting the sick care system and doing your own thing, you might look around, you might say, my only options are I work at a smaller hospital, or I have to get angel investment or venture capital or something. Dr. Ovadia is here to tell you, actually, you can literally start a practice in your spare time, by which I mean sleep less, because that's apparently healthy. And it actually is possible. And then let that grow until it's at a point where you can leave your day job, or don't, or keep doing your day job. Dr. Ovadia does about 2 to 3 surgeries a week on average. He travels a lot for those, but he's still actively doing his day job. And that creates an interesting financial incentive process where the company doesn't have to go make Dr. Ovadia as much as being a surgeon does. He can actually focus on the health of our patients as opposed to how much cash is he bringing in this month. Very unusual. And the current system says doctors are either employees where they're getting a paycheck and that's it, or there's something like 10% of them that own their own companies and they're constantly worried about cash flow and how can they go get people to utilize their services more, which is just different incentive models. We have something else here that we believe that other people can copy. And we need something. What do you think, Dr. Ovadia? We need about maybe 10,000 people like you or so across the country. That's probably about 10,000 would be enough of these small practices where there's a handful of medical providers, but there's only a handful of medical providers, which means there's only a handful of patients, relatively speaking, compared to Kaiser, let's say. How many patients are there in Kaiser? How many millions of people? So the chances that you can need more than just a number, it's impossible. It's completely impossible. You want to work with a company, and both you, the patients listening, or future patients, you want a doctor that actually cares about you and remembers your story. And doctors out there, you want to work with people that appreciate the fact that you remember their story, because you can remember their story because you're only working with 100 or 500 patients, some relatively small number. And that's possible.
Brian, I'm guessing you've probably done the math, but as a marketer, I've been looking at this particular problem. And the place I started was, how many patients can any individual doctor successfully treat?
Yeah, it depends on their level of illness and what they're working on. Some kinds of illness are drastic and vast. Some are relatively straightforward. Some people, their metabolic health is messed up. But if they would just change their diet and then move some more while paying attention to the metabolic health markers, the metabolic health would improve and everything else would improve by 20%. And they weren't really sick anyways. And so the total amount of treatment required is relatively low. Other people have a lot of very serious challenges where they have, let's say they've already had one heart attack, they're obese, they also have type 2 diabetes, they also have some kind of genetic illness they're fighting at the same time, and they require a lot more effort. So the question for you as the doctor listening to this is, who do you want to work with? The people most willing to pay you money are the people who are the sickest in general. Those also take a lot of energy to treat. At Ovadia Heart Health, we try to treat everybody. Some portions of the people with us are quite ill. Some portions are quite healthy. And by focusing on metabolic health first and foremost, and the fact that we're led by a heart surgeon, we're able to say, if you want to be healthier, you need to improve your metabolic health. Almost all Americans need to improve their metabolic health to get to a baseline level of health. That's apart from any illness you may be facing. Almost any illness you face will be improved by improving your metabolic health. So we're going to be able to have our health coaches, which are not medically licensed people, but they're able to help you change your diet, your exercise, your overall metabolic health markers, because they're working alongside. They're not working under exactly. They're working alongside and with more frequent contact than a licensed medical team.
Ooh.
So we have the 1-2 punch here against disease and illness, which is something that is not quite normal. My wife used to work for a healthcare company as a health coach. And when she started, it was very personalized, and you got to just talk with your health coach as much as you wanted. By the time she left 4 or 5 years later, they're tracking you down to the minute exactly what were you producing, how many patient contacts. Her panel wrapped from something like 100 patients to 500 something, completely impossible. And she gets 100 new people every other week. It was a completely, and this is before AI, it was completely an automaton situation where besides drink less Coke, there was no suggestions that she could possibly give by the time she left. At Ovadia Heart Health, we're
Drink
saying
less Coke.
it was horrible. For 5 years, I got to watch her do this. And she started before I met her. But my wife, she really wanted to help people. And she remembered back when she got to treat people as individuals. But as that company grew, which they work with companies like Coke, for example, they're a huge company now. But when she started them, they were this small, innovative health tech company. And it was a lot of promise there. We're going to help people out. We're going to see them far more than their doctors can see them. And we'll be the employer provided health coaches that will really help people change their lives. Problems. They were health focused, not metabolic health focused. That opens the door to pharmaceuticals being a big part of the answer. But also, why don't you just follow the American Heart Association guidelines? Why don't you just follow the American Diabetes Association guidelines? If you're health, quote unquote, focused, you should probably follow what these industry sponsored groups tell you to do, because that's the government guidelines. Like the food pyramid, that's the government thing. So you should just do what the government tells you to do. Whereas the Dr. Vadia's practice, we don't have to do that because we're doctor led, we're surgeon led. And when you think about who among all different kinds of medical people out there, who has the least tolerance for BS?
Yeah.
If you're a psychiatrist or you're a therapist, you might have a lot of try this out, try that out. It might work for you. Come report back next week. If you're a surgeon, there's no trying out here. There's no, I'm going to cut that and see what happens. Oops, that didn't work. Let me try this out. That's not the thing. And so you bring a surgeon's level of, we have to do the right thing, we have to do it in the right order, and we have to do it now, or bad things will happen to you. I've never asked Dr. Vadia, and I still won't, how many people you've lost on the table. You talk about one in your book, that's how you start your book. People come to us at trade shows, they talk about, I read your book, the first story you told, it broke my heart. But how many times have you had to make decisions because someone else did not make decisions before they got to you? And you had to guess, because a lot of medicine is not a science. It's guessing. It's very educated guessing. You've lost an unknown number of people because they did not make decisions in advance to change their health. So you're in a great position to have the moral authority, and doctors listening, this is for you, to have the moral authority to say, don't be like so-and-so because so-and-so died. And I got to watch them as I did my absolute best to save them, and I failed because no one could have saved them. So the big opportunity in preventative healthcare with a metabolic health focus delivered by telemedicine is now you can grab people from anywhere in the nation or the world. Dr. Vadia, heart surgeon, very easy to say. You don't want a heart attack, do you? Come join our practice. But for any doctor, you can choose a very specific niche. You can work with, just to make a ridiculous example, men over 80 years old who are fathers, who rent their homes, who have 3+ kids, and you can get incredibly specific, who have had type 2 diabetes but stopped it by their age of 40 and started smoking in their 70s, but only cigars. You can get as extreme as you want in your targeting because you have the whole nation and the whole world to sell to now. And that's a huge thing because you can get really specific, saying, run with me if you want to live. I'll save your life. That's very bland. And unless you already have a huge number of followers on social media, it's never going to work. But if you say, I help these very specific people, this very specific issue, run with me and I'll help you out because I understand your problem. Dr. Vadia, how many surgeries are you up to? About 3,300 or so? 3,400 heart surgeries?
Yeah.
That's the guy you want holding a needle, making decisions on if you live or die today. And a lot of doctors, it's not quite that vivid, but a lot of doctors have experiences where you can say, if any doctor comes to you and let's say, I just recently saw a relative of mine, he's in his 80s, type 2 diabetes, has been diabetic for 50 years, 60 years, a very long time. And I remember opening his fridge decades ago and thinking, how are my relatives still alive? There's no food in this fridge. In my 20s, I said this. I thought, how are they still alive? My aunt has since passed. My uncle's still here, but he's still eating fake food all the time. So any doctor listening to this, you could decide, I'm going to start a practice for men in their 80s with type 2 diabetes. You could get that focused if you wanted to, and then you could work with 1,000 of them. And
plenty of them out there. Yeah, it's interesting, Jack, the question you started with, right? How many patients is the right number for a doctor to see? It's something we've thought a lot about, right? And the answer really is it depends, right? Because a lot of those things that Brian was talking about affect how many patients you can see and actually deliver the care you want to deliver, right? Because the insurance companies that now own a lot of the medical practices, they say see more patients, right?
Yeah.
And they've kind of trapped a lot of doctors in this situation where the amount that they pay doctors per patient that they see is low enough that the doctor needs to see 4 patients an hour, right? 15 minutes is kind of the standard approach. And realistically, what you can do in those 15 minutes is you can go down a checklist of symptoms and a checklist of lab values and deliver a checklist of prescriptions. And there really isn't a lot of room for doctors to do much more than that. And the problem for the doctor in this situation is the patients keep getting sicker, right? If you talk to most family practice, general practitioners, internal medicine doctors, right? Have your patients as a whole gotten healthier or sicker over the past decade? Almost universally, they've gotten sicker, right? And so now they're trying to see these sicker and sicker patients in this little amount of time. When we started thinking about how to do this differently, right? The answer, like Brian said, is obvious. Make the patient healthier. They don't need you quite as much anymore, right? Bring in the tools that other people can do a lot of what it takes to make them healthier. Health coaches, for instance, have been a huge asset to this practice. And that has allowed us to see more and more patients while actually maintaining and improving the quality of the care. They're getting healthier and everyone wins in the end. And again, don't understand why this isn't the standard approach, why we aren't doing this more in medicine, but that's the path that we've been on. And it's a very viable path. We've had great success over the past 5 years, and I hope that it does become the standard.
It's fear that most doctors have medical school debt. How long does it take to pay off med school debt? A decade, 20 years? Significant amount of time.
Yep.
And what are all the costs associated? If you're a doctor in a hospital, you don't have any direct costs. The hospital takes care of your licensing and all this other stuff. If you start your own practice, now there's this huge number of costs. And it's not even obvious what all of them are, but there's a lot of details. You just said you just finished getting licensed in your 50th state. We have a team member whose job it is to deal with licensing because it's a lot of work. And that's per licensed medical person. You don't get licensed as a practice, it's per person. There's all this paperwork, there's all this money. And it's terrifying to think I'm going to give up my day job, which is lucrative, but not compared to my debt load. I'm going to give it up. And my plan is to stop making any money, to keep all of my debts the same, to take on new debt to start a company, including medical licensing and my own malpractice insurance while having no clients. And I'm going to go sell that to my spouse and my kids.
What the hell was I thinking?
Why would you not do that?
You didn't do it that way, Phil. You said, my plan is I'm going to sleep less, something I can control, while keeping on being a doctor at the same time. And it's this part way. Bless the doctors that are willing to go burn down working for the establishment and start their own thing. Good for them. There's not very many of them.
Yeah.
It's terrifying. Yeah. Way better to go start a practice on the side and start focusing on some area, some group of people you know a lot about, that you really care about, you really work a lot with these people. Ovadia here, we started off, and we still do, a lot of our patients have some kind of cardiac history or active cardiac issue. Why would they want to be with us? Ovadia happens to know a vast amount about this topic area, both from who he's worked on, but also from his own health. So we have an interest area where it's credible. You can say, does this heart surgeon who has made dramatic changes, and I've seen the before and after photos of his own life, and you can talk to me about his own lab work, does this guy, is he credible around the specific heart issue I'm having? The answer is almost always yes. So for the doctors listening, what's the thing that you can talk about where you can say, I love working with people of X, Y, and Z, and I help them achieve outcomes A, B, and C. Dr. Ovadia, what percentage or how often do we help people reverse their type 2 diabetes in the practice?
I mean, yeah, on a routine basis. I would say of the patients who come to us with type 2 diabetes, by the time they've been in the practice a year, 75%, if not more of them, are no longer type 2 diabetic. They've normalized their blood sugars.
Everyone listening to this, if you ask your PCP who is employed by an insurance company directly or indirectly, can you reverse type 2 diabetes? They are required to say no. If they say yes, they're just getting fired and delicensed because they don't own themselves. And all the doctors listening to this, you know this is true. And it's part of where your judgment as a doctor rubs up against the economic reality of being an employee and who pays you. And so if you follow the Ovadia path of start a telemedicine practice on the side, you can start to speak the truth because no one can hurt you. And if eventually your employer gets wise to the fact that you're reversing type 2 diabetes, which is not allowed by the establishment to say that, and they fire you, great. Good thing you already have a side business. Now you can go all out.
Yeah, a lot of this is about physicians. One of the things we always talk about is taking back control of health, right? And that goes for individual patients taking back control of their health, but it also goes for physicians taking back control of the healthcare system. And that was a big motivator for why I did this, because like I said, physicians are trapped within the system. If you give the physicians the two options of how to practice medicine, right? What we're doing here versus the standard, I think very few would choose the standard if they really had the option. But most of them don't know that they have the option because of all the things you alluded to. That's the way the system is set up. One of the statistics that is most troubling to me is when I started my career, not that long ago, right? 25 years, right? That I graduated medical school. At that time, most physicians were still independent. They owned their own practice or they worked in a group practice that they all owned together. Today, that's incredibly rare. It's like less than 10% of physicians are truly autonomous. And that lack of autonomy has allowed all of these problems that we're seeing within the healthcare system. It's not physician-led anymore.
Well, it enables lobbying. If you had 100,000 independent doctors, it would be really expensive if you sell any particular kind of drug, let's say a statin, to go lobby 100,000 doctors. But if you can lobby 10 healthcare firms, the 10 biggest insurance companies, and you can lobby the right people to change the guidelines, it's really effective to spend $10 million, $100 million per each of these 10 big healthcare companies. And you can buy a lot of attention for $1 million, $10 million, where you just couldn't if you had 100,000 independent doctors. So it's a disaster for the doctors. It's a disaster for the patients. And it's really good for if you own stock in those pharmaceutical companies for the short-term results. But all the incentives have just been skewed. That's why I started off by talking about incentives. The incentive problem is just huge. And a lot of the doctors don't understand that they have choices. They perceive there's only one path. And it's just not true anymore. So we're hoping with Ovadia Heart Health, we're able to show you, the doctors, you have choices, and you can sort of copy us all the way down to you don't need to go turn off your day job and turn on your telemedicine practice. You can do it bit by bit. It's okay. Go get 10 patients. Get 10 people to pay for healthcare services that are in line with your medical licensing, including location, which are allowed to do everything else. Play everything by the rules. You don't need to go break any rules here. You're breaking societal standards that tell you that you ought to sit down, shut up, and stay an employee, but you're not breaking any laws. In most cases, you need to go look at your employment contract. that talks about competition. Make sure that you're clear there. Maybe hire a lawyer to review it for you. But you can just go do things. Just go start your own practice. Find 10 people that have something that you're a particular expert in, that you really care about helping people with a particular kind of suffering. And then nationwide, go ahead and find people. Now, one part of the question is, even if the doctor says, that's a great idea, I'm going to do that. How do you find those people? Dr. Ovadia, how did you find your first 10 patients?
Yeah, I mean, it started really with just friends, family, colleagues at the hospital at the time that were seeing the results that I was getting, all the weight I lost and how much my health improved, and just saying, what did you do and how can I do it? Right. And so it started with that kind of guidance. And then in the various, we'll call it social circles that I was in, just again, friends and friends of friends, right? That just wanted to know how to do this, right? And wanted a doctor to guide them. That's really the first start. And then when Brian and I started working together, it then expanded into, okay, let's do this on social media, right? Let's start talking about this.
There's 3 legs there. So step 1 is friends and family, colleagues. I would say to any doctor, find your first 10 patients there. If you can't find 10 people within your circles who trust you enough to give you $1, then something's wrong. Either you're not actually an expert that you think you are, or something else is happening here. Find your first 10 patients there. But then how do you accelerate? In our case, with Ovadia Heart Health, there's a 3-legged stool. So here's some behind the scenes for all the doctors out there. One leg is Jack here. Jack, how many podcast episodes have you done so far with Ovadia?
Closing in on 250.
250. So that's over 5 years. That's an incredible amount of hours spent. But it's not just getting more people to hear Ovadia's message. It's training Ovadia how to speak about things. Because by Jack asking questions and subtly changing the questions he's asked literally hundreds of times, he's helped Ovadia in this specific format of, while being recorded, while being live, how to speak. So that's one leg. And then now we're up to how many downloads a month? Are we 10, 20,000 downloads a month? I don't remember, across all channels.
Well, on the audio side, we're at about 20,000, and the video side is, I think we're closing in on 50,000.
Okay, so we're at a significant traffic level, but we got there starting from 0. Okay, so that's one leg of the stool.
0. Yeah.
Is podcasting. And specifically not just press a button and go live, but have someone who knows what they're talking about to interview you to go help you get better. 5 years of how to talk about these things, coaching from Jack, has had an impact on Ovadia. What's the second leg? That's the book. Stay Off My Operating Table, the book. Ghostwritten by Joshua Lysick, where we had a guy who really knows how to write stuff good, asking Ovadia lots and lots of questions over a while, and to better explain things, and then saying, is this the right way or is that the right way to say it? And saying, how many months, 10 months of time did you take to write that book?
About that, yeah.
A lot of questions. Most of 2021 was spent with Ovadia and Lysick talking and getting this book written. And then the third leg was me on Twitter, X now, choosing one social media platform to go really hard at and going and writing a lot. Some of our big interviews we got came from interactions on Twitter and just doing a lot of support on there. So we have training in how to speak verbally from Jack, as well as traffic comes out of that. Training in how to write clearly from Joshua. And we get, how many books have we sold now? 80,000 or 60,000 or something. That's a lot of books have been sold. We're in the top 1 or 2% of books ever written at this point. I don't know, but it's a lot. And then we have me on Twitter, both engaging with other people, creating partnerships, and finding out the language that really dials it in and really gets people to wake up. What's the right level of simplicity for how to say, Ovadia knows a lot of complex stuff. He can start talking in ways that make us all of our eyes glaze over in 5 seconds. So how do you find the right level of specificity that's clear, but also complex enough to make a good point? That 3-legged stool, that's the second stage, I think, of growth, is you need to go get these other professionals, which you can now afford to hire because you're making money from the first 10 patients, to go help you learn to speak better, write better, and have social media presence on one platform. And then from that, everything good came, because all these team members have been around since 2021. It's 2026 now. 5 years of compounding interest of both us all working in our lanes, but then also all of us training Ovadia on how to really talk about what he does. So he's not just technically accurate, but also can be on a stage talking about it, or can go write something ad hoc and write about it in a way that we already know it's going to work well, because we've already tested it. Jack's already tested. If I ask this particular question 100 different ways, what way gets the response that really is the right way? And then Ovadia takes that to his TED Talk or on stage with Diary of a CEO or Pompliano or any of these interviews, or we were just at the Hack Your Health conference, or we were just at the Big Table conference. We keep on going to conferences, and Ovadia is on stage, and he's not saying the thing for the first time. He's saying the stage for the 50th time or the 500th time, because he's had Jackson's 2021 doing media training light, in a sense, of how do you talk about this one question? And so all doctors, a lot of doctors, you know what you're talking about, but if I put you on stage in front of 1,000 people, you don't anymore. You've lost it, and you can't figure out how to speak. Or if I say, open a Twitter account, you say, what do I write about? Yeah, you need to find someone to help you figure out how to write about stuff, because writing on Twitter is not the same skill as opening people's chests and saving their lives. It's different. Of course it's different. And yet we pretend as if because doctors are smart, your expertise ought to transfer domains. It never does. In Ovadia's case, Ovadia, you did two smart things. You didn't quit your job, and then you hired smart people. These two things together were really smart, because then you could afford to grow slowly. You weren't all in all at once. You could afford to invest what you're making in hiring people to help you grow, which led to not needing to be in a hurry and also being happy to see patients fire you. And that's the big thing of courage, I think, here. We think of, oh, if someone fires you, it means you're a failure. That's how society works in general. But if you're going to do a telemedicine practice, you actually really want your patients to fire you, which means you need a business model that accounts for that. You need a high churn business model. That's a disaster. Churn's horrible. When someone hires you, you spend all this money to acquire a customer, then they leave a year later, 2 years later. Our average patient is 1 to 2 years. We have some long-term people who love us. We have some long-term people with health issues that don't lend themselves to being fixed in 1 year. We have a lot of people that after a year or two, and I'm good, or even one conversation with Ovadia, they say, wow, this has changed my life. I'm good. And you can't do that unless you have the fortitude and the bank account to say, I'm so glad I can help you, buy, and watch that customer acquisition cost go out the door, because you spent all this money to acquire a customer and you only broke even, but you broke even, their life was changed forever. And in Ovadia Heart Health, that's a trade-off we make all the time, and we love it.
And the important thing you talked about of finding people to help you, really, again, it's kind of not something that we've been trained as doctors to do, right? You're supposed to be able to figure it out, but realizing where your domain expertise are and where they aren't. No one's going to go and try and perform their own heart surgery. They're going to find the heart surgeon who's an expert in that. And I realized early on, right, me trying to do marketing, me trying to do sales, do all this business stuff, right? Not my forte. It's not what I've been trained on. And yeah, I could put a lot of effort in and learn it. I'm confident in that. But why would I do that when I had a great people in my circle already, right? Like Brian, like Jack, who could just help me do that. And that's something else that I think, because doctors have lost that entrepreneurial spirit. And one of the things I realize about our medical system and our medical education system is it's really very anti-entrepreneurial anymore. Didn't used to be that way. Doctors used to be entrepreneurs. They had to know how to run their own practice and do all of this. And that's all been offloaded, we'll say. And the business guys, the VC and insurance guys who have bought up all the doctors' practices say, oh, we're doing the doctor a favor. They don't have to worry anymore about that. They can just worry on taking care of the patients. Maybe that's true, maybe not. But again, as I thought about, okay, I want to be independent, but it's not my strong point running a business. It's not my strong point doing marketing. And let me reach out to the people that I know that are strong in that. Or if I don't know people, let me go find people. That's the magic of the internet these days. We can connect with people who do this stuff and let them help you. It really makes it a lot more efficient, I'll say.
In our last, maybe it was 2 Ask Me Anything webinars ago, I always ask people, where are you calling in from? And we had 7 different nations represented in the audience in that particular, just go ahead and ask Phil a question about whatever call. And that speaks to, by having a particular focus, which is improving cardiac care through improving metabolic health, and then doing the same thing for 5 years and partnering with the right people, now we have, in that particular call, 7 nations hopping on to go ask questions. I think anybody, if you get specific enough about a real problem that enough people have, that you could go ahead and find some kind of results like that. You just need to get specific. And it's really easy for a heart surgeon to be specific because your domain expertise, while you know a lot of various stuff, it's really focused on this one thing that you can eat. And it's very easy to describe. I'm a heart surgeon, and everyone knows what that is. Everyone's already scared of it, and everyone already respects it. Heart surgery and brain surgery are those top two tier of respect things. If you say that you are a kidney surgeon, people are like, oh, you're a surgeon, that's cool. But we don't have a deep personal grasp of what a kidney surgeon does. How many kidney surgeons are there? Do you know anyone who's ever needed a kidney surgeon? I don't know. It's sort of weird. So you got to figure out what's the specific problem that you deal with, and what are the questions that people are asking or related to your topic area, so you can find out where they're asking the questions and then go develop different answers. One of the questions we get all the time is, my doctor is saying I have to take a statin. I don't think I want to take a statin. Help me not take a statin. And because statins are a universally recognized phrase, and a lot of people have this exact same problem, it's very easy for us to talk about and for Ovadia to get more refined at talking about statins. What are statins? What's the research on statins? The real research, not just what your doctor's giving you. What are the downsides? And just talk about the same thing again and again. So for any doctor listening to this, you need to get really tight into what's your niche and what are the problems they're actually bringing to you, even if it's not the same thing as the core problem. So you can go answer those and then answer them in depth. And you don't need to have a Jack Heald, though he certainly helps. You can just start going live. You don't need a me. You can go choose a social media platform, choose Instagram, whatever. Just start going live and answer questions. Go find people asking questions about your topic area and go start answering them on video, live, and say, I see so-and-so asking about such and such. Here's my take. And then start talking about it. The chances are you will get better at speaking just by doing it. A lot. In our case, I laugh sometimes, Phil, at your level of stage presence when we first started working together in 2021 compared to now, where now I've been to these conferences where it's hushed as people are on the edge of their seat because they can't wait to hear what's going to come out of your mouth next. And this is different than your level of stage presence when you started and when you were more awkward. Turns out 4 years of practicing talking about something, both in podcasts, on live videos, on stage, you got better at it. Just 4 years, that's as long as med school. So any doctors listening to this, even if you're not ready to start your own practice yet, even before starting your side business, just start going live. Choose one platform. Don't do all of them. Choose one. It's a podcast. It's Twitter. It's Instagram. It's Facebook, whatever. Start going live and do it. So step one is start going live. You don't need to even be answering questions that you personally got asked. You can grab someone else's questions that they got asked. You can grab Dr. Ovadia's questions. You can look at what he publishes. You can steal the questions he's answering and answer them for yourself. You can do that for 10 doctors in your field. Completely legit to say, so-and-so answered such and such to this question. Here's my take. You can do those kind of doctor reaction videos to any doctor you want to, completely free. It's not stealing. Just say, hey, I saw so-and-so talked about this thing over here. Here's my take. You can do that. And eventually you can start doing it consistently. Like every Monday at 7 a.m., I go live and I talk about Thing X, or every Saturday evening, whatever it is. And then initially, no one's going to be listening to you, and it'll be depressing because no one knows who you are unless you already have a social media presence. But eventually, you'll have a backlog. You'll have this history, this archive. Hey, I've spent the last 200 weeks answering specific questions around my topic area. And people will start to ask you questions eventually, or people will ask you questions and you'll say, that's a great question. Here's a link. I discussed that for 35 minutes on this link. Go listen to the video. And then here's another link to book a call to join my practice for next week. After you listen to this and you realize, I know more about this one topic area than your PCP has ever told you. Why didn't they tell you the details you're about to learn? Listen to this link first, though I wouldn't mind. It's okay if you just want to hire me and we can dive into it. But if you want to listen, go ahead and listen. Any doctor can do that who's actually good by choosing what's your real topic area and then getting focused. We don't do podiatry here at Ovadia Heart Health. I'm sure Ovadia has opinions about foot health. Who cares? And if you ask him or a nurse practitioner or one of our coaches, they will have opinions, I guess. But I don't believe we've ever sent out a tweet or a podcast episode or anything about foot health. I love my feet. Feet matter a lot. We ignore them. We focus.
We got to get I have a few experts in mind. We'll add them to the list. But yeah,
well, now that we're discussing foot health. So I've been a barefoot hiker, a barefoot climber. I've bicycled barefoot for long distances. I have lots of opinions about foot health, which I never talk about Because metabolic health is the story where almost everyone has a problem, almost everyone get healthier by controlling the problem and improving it, and almost everyone actually themselves can improve the problem if only they knew what to do. What a fantastic problem. Those four things all in a row. This is a place for anyone to shine.
This brings up another kind of different way of doing things. You talked about you shoot the video on this topic, and then when people keep coming to you, inevitably, as they do with that same question, right? You can now say, okay, here's the answer, go look at this. And again, as we're thinking about how do you scale this as a doctor, a lot of what doctors do is repetitive, right? We have to tell different patients the same thing. And when you start thinking about different ways of doing that, if you start telling patients, well, before we have our appointment, go look at these things, right, that are sort of foundational. And then you don't have to spend the time during the appointment going into those details. Or group calls, right? This is something else we do within the practice. Once a month, we have a group call with patients that are in the practice. So they're all my patients. I can give them medical advice. It's not like a public session where we can't do that because they aren't my patients. And the patients ask these questions, right? And one patient asked a question, but 5, 10, 20 of the other patients had the same question in their mind or are dealing with the same problem. And now we can answer it. And now they've all had their answer, right? So these are now 20 less questions that we then have to answer individually. And things like that are, again, a great way to be scaling a practice and taking care of more people with better results. And it's one of the things we learned along the way. We didn't do that from the beginning, but it just kind of occurred to us, like, patients have the same questions. Let's get them all together. Patients learn from each other, by the way. Something else that doctors, right? It would never occur to a doctor in traditional practice, let me have like my two patients with the same problem talk to each other, right? You bring up all sorts of, they start getting nervous about HIPAA and you can't discuss things. And no, just get all your patients in a room together, right? And let them start talking and they're going to start helping each other. And it's just, again, some of the things that when I was a doctor sort of trapped within the system and within that bubble never would have occurred to me. And now I look back and say, duh, like why don't we do this every day in medicine?
Let's talk about the numbers behind scaling for a minute here. I'm going to use some
Hey,
very
Brian, we've got your mic is just a little low.
My mic is just a little low. How's that?
There you
Is
go.
that a little bit better?
Much better. Much better.
Okay, so let's talk about numbers a little bit here. And these are just big round numbers for sake of easy use. 100 patients paying you $10,000 a year is $1 million. $1 million is enough to fully replace your income as a doctor. The average doctor salary in the US is $250,000 to $300,000-ish. So you can replace your salary. You can afford to hire a second licensed medical provider. You can have 1 or 2 office people, and you can provide a level of care vastly in excess of what you're able to provide in your current day job. This is true for not all, but most practitioners. If you're a brain surgeon or something, maybe it's not enough for you, but for most people, this is true. Now, $10,000 is a lot of money, but you got to compare this to what people pay for their insurance. Right now, I have one of the most expensive health insurance plans in Washington State. I pay $1,700 a month for me, my wife, and my kid. Our insurance covers almost nothing. We're going to be canceling it momentarily.
Such a deal.
We're laughing. Like, wait a minute. We spent over $20,000 on health insurance, and it covered, because they routinely comes back and says, oh, we're not going to pay for that. Oh no, you had to go. You couldn't go to your local hospital for your kid's health issue. You had to drive to Seattle. That children's hospital in your town is not covered. This has happened. And they say, no, you had to drive to Seattle for that. Hour and a half away. It's insane. So on the one hand, $10,000 a year is a lot of money. On the other hand, it's really not compared to the current health insurance, what it costs. And I've looked at what's the cheapest plan I can buy that has an HSA so I can at least sort of have some tax advantage. For my family, it appears to be $700 a month. The insurance we're currently paying for doesn't cover anything. I presume they'll also cover nothing. At least it has the HSA tax shelter, which helps a little tiny bit. Or there's other options out there. But I'm already taking a $20,000 bill, which is a lot of money to me. Maybe not to some of you, but to me, $20,000 is a lot of money. I'm lighting a match to it every year. And so your people are too. your people in your audience who would listen to you, would love to work with you, and maybe not locally, but globally or nationally. And if you say, hey, $10,000 a year, work with me, and I will be able to help you do X, Y, and Z, whether you're doing a focused care like we do with cardiac care, you're doing a primary care offering, whatever. And then all you need is 100 patients. You can actually learn their life stories. You can care about them. Some of those people will see you a few times a year. Some will be calling you every day because that's the nature of the variation of people and within their life story. But how better off would we be as a nation if most doctors, if instead of having 10 or 20 doctors offering telemedicine care, if we had 10 or 20,000 doctors, and instead of me lighting fire to a $20,000 bill a year to get no services, instead I can pay $10,000 a year to get actual service, and then maybe 1,000 or two in lab work or procedures or something else there. And there's other options like crowd health to help mitigate that cost. So this business model is actually obtainable by most doctors. If you're someone like a radiologist, maybe there's probably some niches there where you really do need to be attached to a large system. Most radiologists can't strike out on their own, probably. But most doctors are in a position, and even as we said, you don't have to go quit your day job. You can start a side business doing this. Then you don't need 100 patients. You need 10 patients to prove the concept. And now suddenly, that's $100,000 a year. You now, on the average doctor salary of $250,000 to $300,000, you've now already replaced almost half your income with almost no overhead. There's only 10 people. There's almost no overhead. There's an app to keep track of their health records. But you don't even need any staff to take care of 10 people. You can do it all yourself and get back to the taking care of people, which is probably why you joined being a doctor in the first place, because you wanted to heal people.
Yeah, the perception, right, of how much patients should be paying you. And again, this is something that's been very altered by our healthcare environment where doctors are working for a company of some sort, right? Whether it's a healthcare system or an insurance company or some sort of large private equity thing. And doctors have been fooled into thinking, right? So the patient, I get paid X amount of money for a visit, right? The typical family care doctor, right? Every time the patient comes in for their visit, it's going to be 100, 150, maybe $200, right? That they're going to get paid. And so they think that's the value of a visit with a patient, right? And what they're not seeing is, yes, there was $200 that ended up in the doctor's fund, wallet, whatever, but there was how much went to the insurance company, right? How much went to the pharmaceutical companies? And when you can now say to a patient, yes, it's going to be $10,000 a year, right? But I'm going to get you healthier. So you're going to save all this money on the drugs that you've been on. You're going to not need your insurance coverage anymore, or maybe not need that high level of insurance coverage anymore. You're going to save money that way. And then you can get into the indirect costs that go with being unhealthy. What's it worth to you that instead of spending your time sick and miserable and on pharmaceuticals and all of this stuff, right? You're actually going to have a healthy life. You're going to be able to spend more time, more quality time with your children, with your grandchildren, with your parents, right? All of these things that are the side benefits of getting healthy. And when you really lay it out like that and you say to a patient, it's only going to cost you $10,000, right? You could make the argument, right? That's worth $100,000 or $50,000. There's great value in what we do as physicians, and we've allowed ourselves to become devalued. And this is another discussion, quite frankly, I end up having with a lot of my colleagues. And they do what Brian said, right? They're like, they've started the side gig and they're kind of starting to do it, and it's a struggle. And they're like, I can't get enough patients because they're only paying me this kind of little amount. And I said to them, charge more. We provide valuable services to people, and we're getting them results. The caveat to what we've been saying is, if you're going to charge a patient $10,000, if they're going to pay you $10,000, A, we now have a direct relationship. It's not going through some insurance company. Very important. And B, they're going to expect results.
Yeah.
Great. we can deliver those results. I have no problem with my patients holding me accountable. If it ever happened, and it hasn't happened, but if we were at the end of a patient's year, right, and they paid me $10,000 over the year, and they came to me and they said, you know what, you didn't deliver the results to me. And if for some reason that was actually true, that I didn't deliver the results, I'd hand them back their $10,000 because I want patients to hold me accountable. And they do. And they're invested and I'm invested. And now the patient and the doctor are working together with the goal of providing value to that patient by improving their health. That doesn't happen in the healthcare system, right? If you go to your standard doctor and you say, you know what, I paid $20,000 to my insurance company this year and I didn't get healthier, right? The doctor is going to say, that's not my concern. And then you'll go to the insurance company and they'll say, that's not my concern either. And ultimately, no one is incentivized to actually get you, the patient, healthier. And that's what's different about the approach that we're taking.
It's time for a history lesson, which is why is the worldwide C-section rate around 18%, but it's about 31 or 33% inside the United States? Who knows the answer to this? Probably not most folks listening. The short answer is that after one of the world wars, we had all these unemployed surgeons. And so they said, what are we going to do with all these guys that come back from the war? And the answer was, we'll put them in hospitals. But what are they going to do? We don't need more surgeons. The answer was, we're going to go and increase the C-section rate because C-sections make a lot of money for hospitals. And before this, midwives took care of pregnant women for the most part. You mostly didn't have surgeons involved working with pregnant women. But after this, it changed. And this big idea of doctor's orders showed up in a very powerful way, where before that, pregnancy and birth was a non-medicalized event handled by midwives at home. And after this, military surgeons were telling you what was about to happen to you, which when in the military, you don't get a lot of choice with your doctors. They just do stuff to you because that's the military. We imported that into our birth system and with disastrous results, almost twice the rate of C-sections as other civilized countries, and just terrible outcomes. We've now metastasized that throughout our entire system, where you're expected to follow what the doctor tells you to do, instead of being a partner in healthcare, where with Dr. Ovadia's practice, if you don't want to do what Dr. Ovadia tells you to do, that's okay. You should probably stop being a member here. But you should have a conversation. You should do your own research and have a conversation. You don't get to be a passive consumer here. This is not a bag of tortilla of Dorito chips. This is not a movie at Cinemark with a big gulp. I'm mixing metaphors here, but bear with me. This is not a thing you're consuming. It doesn't work like that. But that is exactly what you're expected to do in mainstream medicine. Sit down, shut up, and consume the product.
Yeah.
So a lot of good things happen when you stop consuming healthcare and you start participating in your own health. One of the things that happens is your current doctor is not going to work out anymore because that person is part of a system, whether they want to be or not. They're currently part of a system that demands that you consume healthcare, you consume the medication, you consume the medical advice, and then whatever outcomes happen is what happens. Whatever. What can we do? In Ovadia Heart Health, you are a participant. And you'll be told that by the doctor who owns the company, because we're not insurance owned, we're not PE owned. You'll be told that by the nurse practitioner. You'll be told that by your health coaches. You'll be told that by the frontline office workers. Everyone assumes that you are an active participant in your healthcare to the greatest extent possible. That's a really different model. And to the doctors listening, if you heard all that and you thought, I have no idea what that would feel like. What if, instead of my 2,000 person panel of patients I was expected to take care of, what if I only had 200 people? And what if everybody got in general the idea of being an active participant, but 100 or 50 of those people actually believed it and took action and really listened to me and did the research and was really an active participant? And what if instead of telling people what to do, what if I was supporting them in making good decisions? If that sounds like a fun thing to do, then you too should start a telemedicine practice. You should please compete with us. Please do it on the weekends. We don't care. We need 10 or 20,000 private doctors opening their own practices that own their own companies that are not PE funded, not angel funded, not venture funded.
Yes.
That's going to change all of healthcare. Maha is great. Good for RFK. I hope he wins. But it's the doctors opting out of the big systems and realigning the financial incentives with your health goals as the patient That's what's going to save the nation, not any national political change. Please compete with
Absolutely.
us.
Please compete with us. Please. This is a green field, blue sky situation. And
What gets to the heart of we're financially messed up in the head, because not only should your doctor not tell you, please fire us within a year or two, but they definitely shouldn't tell their competition, please open businesses competing with us. But that gets to the heart of, we're doing things differently at Ovadia Heart Health. We believe there's a better path, and we believe it's not just for us, but for everybody. That everybody can be following a different path than what they're following. All the doctors, 10 or 20,000 more doctors can join us.
Brian, the right thing to do at this point is say, for more information or what else you'd like, if you need to talk with somebody about, then contact blah, blah, blah. But that's not really why we're here. We're here to help people get healthy.
If you're a doctor who wants to open your own medical practice, then get off your butt and go ahead and do it. If you need help, email Dr. Ovadia and say, Dr. Ovadia, I love the episode. I don't know what to do next. And Dr. Ovadia will copy a template that, let's be honest, all probably right, that will say, where are you live streaming once a week on your topic area? And if you don't come back with a link, he will say, please listen to the episode again because my team already told you what to do. Start live streaming somewhere. Just start doing something. We need the doctors to step up and stop just being talented within your domain and start taking responsibility for our nation's health by owning your own companies and competing with us.
Absolutely. I love it.
Any last thoughts on Ovadia as I tell you to people to go and compete with
No,
us?
this was a great conversation. We didn't know exactly how it was going to go and what we were going to talk about, and this might be something that we want to start doing on a repeated basis, because this is something that we're passionate about, not only helping patients, but helping practitioners to take back control of healthcare and take back control of their health individually. I think I'll just wrap it up by taking the opportunity to thank Brian, thank Jack, thank my entire team for having this vision with me, being on this mission with me, and making it possible. This is certainly a very team-based effort, and I couldn't do these things without them. And I think this has been a wonderful opportunity to kind of reflect and also project forward as to what the future of medicine is going to look like and how all the practitioners out there can help shape that.
I think that's all that needs to be said. Hey, Brian, I'm really glad you agreed to do this. I love hearing the big picture vision of how to make this all happen.
It's been
And
fun.
Phil, yeah, let's do more of this. I like it. All right, for Brian Keith, the Chief Operating Officer of Ovadia Heart Health, and Dr. Philip Ovadia, the founder, president, and chief bottle washer, I guess. This has been Stay Off My Operating Table. Thanks for joining us. We look forward to talking to you next time.
Chances are you wouldn't be listening to this podcast if you didn't need to change your life and get healthier. So take action right now. Book a call with Dr. Ovadia's team. One small step in the right direction is all it takes to get started. Contact us at ifixhearts.com/talk. That's ifixhearts.com/talk.